Hello, I'm Dr. Jim Buscher, and I'm a Pediatric Emergency Medicine Fellow at the University of Florida College of Medicine in Jacksonville. Today, I will discuss my abstract, Temporal and Environmental Trends in Pediatric Submersion, a year-round phenomenon. I want you to imagine that you're scheduled for an evening shift on December 21st. It's about 5 p.m., and you're notified by EMS that they're bringing in an unresponsive 5-year-old receiving CPR who was found in the ocean without any respiratory effort. While this doesn't happen often, the time of year does not prevent submersions from occurring. Submersions will affect every emergency medicine physician. While it can occur in all ages, it is the leading cause of death for children 1 to 4 years old and the second leading cause of death for those 14 years and younger in the United States. My current state of residence, Florida, leads the country in submersion deaths for those 1 to 4 years old. In addition, submersion does not affect every race equally. Studies have shown that African Americans and Hispanics have a higher incidence. In addition to race, those of lower socioeconomic levels also tend to have higher incidence of submersions. The purpose of my study was to characterize submersion injuries and deaths in my current region and compare them with the current injury prevention guidance, such as the AAP policy. Significant prevention efforts have focused on reducing submersion events, yet submersion remains a leading cause of morbidity and mortality worldwide in the pediatric population. In 2017, the World Health Organization published recommendations to try to decrease submersions. They focused on 6 aspects, including barriers, safe places away from water to play, teaching children older than 6 years to swim, bystander intervention, managing flood risks, as well as safe boating, shipping, and ferry regulations. The American Academy of Pediatrics also updated their policy statement in May of 2019 and emphasized 4-sided pool fencing, life jackets, swim lessons, supervision, and lifeguards. Other interventions were also discussed, such as CPR. With regards to our region, Jacksonville is a large city with a population of greater than 900,000. 31% are African American, and the poverty rate is higher than that of the nation at 15.9%. Gainesville is a smaller city with a population of about 133,000, but does have a substantial African American population at 21.4%, as well as a higher than average poverty rate at 31.4%. The patient data was obtained originally to be utilized in a multi-center study through the PIMS-CRC and Texas Children's Hospital. This retrospective study evaluated the charts of pediatric patients less than 18 years of age who were evaluated for unintentional submersion injuries. A sub-analysis was then performed using the data from our region. Once our data was obtained, descriptive statistics were used to evaluate and describe our review. However, due to the low N, we were precluded from using more advanced statistical methods. Ultimately, the charts of 183 patients were reviewed. Most of the submersions occurred in males and in children younger than 4 years of age. The admission rate was 71%. We also had a total of 13 deaths, with 10 of those deaths occurring in children younger than 4 years. While most submersions occurred in pools and tubs, about 1 in 5 of our submersions occurred in open bodies of water. About 19% of those that occurred in open bodies of water were during the months of October to March. As with national trends, we had a higher predominance of males, as well as those younger than 4 years of age. Interestingly, we had a large percentage of submersions in open bodies of water. We also had a higher than average number of patients admitted at 71%. We were surprised to find that 1 out of 5 open body of water submersions occurred during the fall and winter months of October through March. There were several limitations with our study. First, this was a retrospective chart review of patients admitted to 2 healthcare systems. While UF Gainesville is a tertiary center that receives multiple referrals, the University of Florida Jacksonville traditionally refers patients to the local children's hospital when they require critical care. This led to some information being limited for those patients that were transferred to Gainesville, as well as those that were transferred out of the UF North Jacksonville system. Second, the UF medical centers are in a humid, subtropical climate zone, meaning temperatures are relatively warm for much of the year. Incidents of submersion injuries in open bodies of water may be higher and at different times of the year due to this climate. Thus, the information we obtained may not be generalizable to the rest of the country. Furthermore, our data did not separate fresh versus salt water to further analyze outcomes, as both these types of open bodies of water are readily available within our geographic area. Finally, the data does not consider patients within our region that were cared for at other hospitals, did not seek medical care, or were pronounced deceased in the field. In conclusion, the data suggests that submersions occur year-round. Advocacy should continue for legislation regarding safety in open bodies of water. In addition, the World Health Organization policy statement recommends swim lessons for those 6 years and older, while the American Academy of Pediatric policy statement suggests swim lessons in those older than 1 year may be beneficial. Given most submersions occur in children 4 years and younger, further revisions to the policy statements may be warranted in the future. Finally, emergency medicine providers should be prepared to treat submersions in addition to educating patients and their families any time of the year. Thank you.